Hello. Today we are going to speak about the artificial respiration. It's also a very important topic. In emergency, we go into artificial respiration, and the respiratory system is not working properly. Therefore, we try to assist the respiration. Therefore, it's a very important topic. It may come either a short notes or essay also sometimes. Therefore, it's an important topic. Therefore, artificial respiration means that is we have to maintain adequate pulmonary ventilation. And patients whose respiratory system is not working continuously, but the heartbeat is okay, but respiration is not maintained properly. And therefore, in these conditions, we go in for artificial respiration. Yeah. The person is not able to breathe properly, these other vitals, that is heart rate, everything is normal, but here respiration is this thing, therefore they have been assisting the patient with artificial respiration. This is a hospital setup. And this is a artificial procedure. The patient is being given a cardiac massage. This is a case where when the heart is not beating. This is a case of no. ఏంటి గోల ఇష్టమాన కరెంట్ పార్టీ ఒక చోట అక్కడన్నా పెడితే బాగుంది. భాగ్య 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 పిలుస్తుంటే పడుకోండి వినిపిస్తున్న మనసు అన్ని చోట్ల అక్కడ చూస్తుండే టేపు మళ్ళీ వస్తుందా మరి వస్తుందో రాదో నాకు తెలియదు మరి ఇప్పుడు కరెంట్ పోయి వచ్చింది స్టార్ట్ చేసి వచ్చా కాదు కరెంట్ పోయి
ఆఫ్ అయిపోయిందా?
ఆఫ్ అయిపోయి మళ్ళీ వచ్చింది కదా రామ.
లేదు అసలు మ్యాథ్స్ సిస్టమ్ ఆఫ్ అవ్వలేదు.
Hello. And this is the figure shows the how a cardiac massage is given in case of a patient with cardiac arrest. Now the gases exchange has to be maintained properly. Therefore, the pumping of the heart occurs and thereby the heart is maintained. And therefore, it supplies gases exchange, it supplies to all the vital centers. It also helps to maintain circulation. Therefore, respiration is very important. It also helps to maintain circulation. And therefore, when we give an artificial respiration, after some time, the spontaneous respiratory centers, the respiratory centers start functioning spontaneously, and thereby the patient comes back to normal. Therefore, we have to see from time to time whether his normal respiratory centers are functioning normally and whether he is coming back to his normal position. During artificial respiration, the main thing we do is we give alternate inflation and deflation of lungs. Has to be done. Inflation due to causes inspiration and deflation causes expiration. And this procedure helps in inspiration and expiration spontaneously. Therefore, this is the main thing we do. It is done under two situations. One is in surgical theaters. Here, when an operation is arranged, pre-arranged, that is, we plan an operation, and the mechanical devices are there, all the mechanical devices are there, and the anesthetist sees that the respiration is maintained artificially, even if the patient is anesthetized. Then also, therefore, this setup we mainly see in the surgical theaters. This sees to that the respiration and heart are properly maintained. Another condition we are going for artificial respiration is an emergency condition. Suppose a person has been drowned or is facing some acute respiratory distress due to some accident, or when he has been drowned, then the victim should be given a first aid because he is unable to carry a voluntary ventilator. So many drowning cases we see nowadays. People going for swimming and getting drowned, and suppose we are able to help the patient, immediately we have to see that the ventilation is properly maintained. Therefore, the various conditions in which we are going for artificial respiration are drowning mainly. Some electrical shock, the cardiorespiratory arrestment in electrical shock, in choking. In case of gas poisoning, choking we have seen recently in Vizag, in the chemical factories, the gas poisoning, the gas was released. Most people were suffering with respiratory distress. We have seen in the Vizag, accidents, road traffic accidents, and there may be a damage to the brain stem. Most of the respiratory centers are situated in the brain stem, and these cases also may go in for need for artificial respiration and in case of snake bite. And the one thing we have to see is we have to avoid delay. Immediately we have to see the respiration is established. First you have to clean the mouth of the, suppose in the case of drowning, the patient may have swallowed weeds, mud and all these things, and therefore first we have to see that the mouth is clear of all these things. Otherwise, even if we try to give some artificial respiration, it is no use. Therefore, first clean the mouth out of the debris that is accumulated in the weeds, mud, sand, all these things, and then clean and avoid delay immediate. Then you have to start where there are various procedures of artificial respiration. We will be dealing one by one, and then this artificial respiration has to be continued till original respiration starts. When natural respiration appears, then you coincide this artificial respiration so that it coincides with the natural ones for some time, and then slowly you can wean out. Whenever a patient is in distress, when there is a respiratory distress, inclination of the body, to forward inclination of the body with head downwards is desirable. This position is desirable, and care should also be taken while turning or lifting the patient. Do not insist on any particular procedure, but you have to see the condition of the patient and then proceed. And then types of artificial respiration. There are two methods mainly, manual methods and mechanical methods. Manual methods in which we don't use any instruments, and the mechanical methods in which mechanical events are involved, that is, instruments are involved. And these are the main methods. Holger-Nelson method, and this is also known as arm lift back pressure method, arm lift back pressure method, Schaeffer's method, Sylvester's method, mouth-to-mouth breathing, mouth-to-mouth method. It is mouth-to-mouth breathing, eavesdropping method. Therefore, these are the manual methods. We have got manual methods and artificial methods. Therefore, in manual methods, we have got Holger-Nelson method, Schaeffer's method, Sylvester method, mouth-to-mouth breathing, and eavesdropping method. You have to mention all these methods. You have to mention artificial, what is artificial respiration, in which conditions it is used, and the methods also you have to name the methods. And dealing one by one with these methods, this Holger-Nelson method, it's a very popular method, and mainly it is used for the victims of drowning. Suppose somebody is drowning. So many drowning cases we are seeing nowadays. Children going for swimming and getting drowned accidentally. And therefore, suppose we are able to save the patient in time, his respiration can be restored if these methods are adopted. Practically also, artificial respiration is very important. As a doctor, you can save a life if you are aware of these methods. Therefore, this is of practical importance also. And this Holger-Nelson method is a manual manipulation. That is, intrathoracic pressure is increased and decreased alternately. And this is by compression. We compress externally, we compress the lungs, and thereby expiration occurs. And then when we withdraw it, then alternately inspiration occurs. Therefore, it's a manual manipulation of intrathoracic pressure. Now see the steps. Holger-Nelson method. Steps. The patient is lying down in the head down position. That is in the prone position. Patient lay down in the head down prone position at a face downwards. And then abduct the arms at the shoulders. The arms should be like it is spread out. The arms should be spread out. And it should flex at the elbows. The arms should be spread out at the shoulders, down position, that is waist downwards in a prone position. Arms should be spread but flexed at the elbows. And now you bring those flexed arms in front of your head, and you have to rest the forehead on the hands. These hands are placed one over the other. I hope you have understood the position. Prone position, that is head down position. Arms abducted like this, and then flexed at the elbow. It is flexed. It is extended at the shoulder. Flexed. It is brought down like this, and the head rests on it like this. Therefore, allow the forehead to rest on his hands. You place one over the other. Then you have to turn the head of the victim to one side. That is right or left. You have to turn. Otherwise, you will be practically obstructing the flow of air. Now there is a doctor or there is a stator, and the person who is trying to revive him knees down on both knees at the head end of the victim. The person, he may be a doctor or a non-doctor, but the one who is doing the procedure, he knees down on both knees at the victim's head. And he keeps the head of the victim in between his knees, and then he placed both palms of both hands on the back of the patient, below the scapula on each side. Below the scapula on each side, like this. The patient is lying in a prone position. He is lying in a like this, and he pulls back the scapula on each side. He needs down on the left side of the patient, and he keeps both hands on the below the scapula, lower part of the scapula on each side, so that the two thumbs touch each other, the midline. And now he applies pressure over the thorax, that is abdomen, when the patient is in the prone position. They were resuscitator, that is the doctor or the person who is doing it. He bends forwards until the weight of his body falls on the arms and it crosses pressure on the thorax. His hands are already on the intrascapular region on both sides, and therefore when he is bending forward, putting his weight on the body on his arms, automatically the pressure gets transferred to the thorax, and therefore lungs gets compressed. This causes expulsion of the air, and this causes expression. And this approximately takes about 3 seconds. 3 seconds. And now the process of expression is over now. Really, the pressure on the back should be released. That is, you remove your hands from the back. Lift your hands of the thorax, hold the patient's elbow. Now you are going for the elbow and lift the elbow. You hold the patient's elbow and you lift the elbow upwards. And that is, you bring the elbows upwards. We have a beautiful figure in GK practical book. You have a beautiful figure how his hands are lifted upwards like this. He is in the prone position only, but his hands are lifted like this upwards. Then doing this procedure, what happens? The thorax gets expanded, and this leads to decreased intrathoracic pressure and automatically inspiration occurs. And this cycle is repeated at a rate about 12 times per minute. I hope you have understood. The patient is in a prone position, that is a head-down position. The head is turned to one side to allow the air to flow freely. Anything in the mouth should be removed before the procedure starts. And then the hand should be abducted at the shoulders and then folded at the elbow. And then it brings his hands in front of his face and he rests his head on his face. And then the person who is doing the resuscitation, he sits on the head end of the patient, and he tries to put both of his hands in the below the scapular region of the both hands. Therefore, and he tries to put a pressure on this by transferring the weight of his body on his hands, and thereby this causes pressure on the thorax, and this what happens, the expression occurs automatically. This thing occurs. Thorax gets compressed and the expression occurs, and then after this approximately takes about 3 seconds, and then he tries to lift both hands of the patient upwards. He is still in the prone position. His hands are lifted like this upwards, and this causes a decrease in intrathoracic pressure and automatically inspiration occurs. This is Hans Nelson method. This cycle is repeated at a rate of about 12 times per minute. It may continue till the victim regains spontaneous breathing, and for some time afterwards and see, and then we can discontinue. This is a very easy procedure, but you have to know the procedure, and you have to know the procedure, and this no instruments are needed. Instruments are not a Halden-Nelson procedure. Sharp notes also. Patient is in prone position. Applying pressure on the back of the thorax, that is on the back side. He is in a prone position. And by applying pressure, whatever air is there, that escapes and it will cause expression due to compression. Then lifting his hands decreases intrathoracic pressure, so this is causing expression. Approximately nearing the normal respiratory rate, it is done at a rate of 12 times per minute. It just continue the normal expression. The advantage of this method is both inspiration and expression actively assisted. We are assisting with inspiration. We are applying compression on the back of the body. Inspiration, we are assisting expression, and pulling the hands upwards, we are assisting by the inspiration. Therefore, both inspiration and expression are being assisted. And relatively good tidal volume. Tidal volume, normal tidal volume, relatively good tidal volume is maintained by this procedure if you do it properly. And this is very easy to perform. No instruments are necessary. Because it is done in prone position, what happens is whatever mucus or saliva or whatever comes out of the mouth, it is not obstructing the air passages because the patient is in that pressed on position, that is in a prone position. He is not in a supine position, he is in a prone position, and therefore anything, any that we have already removed. After removing only we are doing all these procedures. But suppose some more amount has been left, that also will come down from his mouth because it is his face is in a downward position. Disadvantages. Disadvantages is in case of fracture of rib, we cannot do this procedure. Suppose a road traffic accident, the patient is already having a rib fracture, or some is having some dislocation of the shoulder or other fractures of upper limb. Then we cannot do this procedure because the shoulder has to be lifted, the shoulder has to be folded, and otherwise during inspiration the hands have to be lifted, and we are applying pressure on the ribs. All these things is not possible if a patient is already, if the patient is already having some fractures like this, therefore this procedure is contraindicated in those patients. And next, when we are going for mouth-to-mouth respiration, this is also a very common procedure. Here also we don't need any instrumentalization. There the patient is placed in a supine position, that is he lies down on his back. The neck is extended upwards like this. The neck is extended like this upwards. And then again you open the mouth and clear the mouth. Suppose there are some beads. Suppose it's a case of drowning. You may have swallowed some beads and all these things. You have to clear the mouth and, from all these things. Put the patient on his back, that's supine position, extend the neck backwards, so open his mouth and clear the mouth beads with your hand, because it's an emergency, you have to clear with the hand only. And suppose there may be cases due to loss of tone, tongue in these patients may be frequently falling back and upset the air. There may be a loss of tone and the patient may be unconscious and the tongue may be falling back. Therefore, all these things you have to remember and see that the air passages are clear so that you can apply the mouth-to-mouth respiration. Therefore, these patients see that the mouth is clear of without any beads or anything, and see the position of the tongue, whether it is falling, it is obstructing the airway or not. You have to see, you have to observe all these things. Just immediately doing mouth-to-mouth breathing, there is all these things, precautions you have to take. And then what you do with the left finger, so the operator, suppose the operator is a right-handed person, the left finger should be utilized to close the nostrils of the patient. The patient's nostrils like this, the nostrils should be closed with the left finger, not the doctor or the person who is giving mouth-to-mouth breathing. He should take a deep inspiration. You have to take a deep inspiration and hold up the close his mouth. Deep inspiration and hold up the breath. You have to take a deep inspiration and hold up the breath. Now you have to apply your mouth in such a way that the rim of your lips exactly fit the rim of the lips of the patient. Therefore, there should not be any gap between the lips of the patient and the person who is giving mouth-to-mouth this thing. If there's any gap, means they will escape and there's no use. But to take a deep inspiration and then you apply the mouth such that there's no gap in between the lips, and then now you blow air. Take a deep inspiration and hold up the breath and blow air and retain your mouth in the same position for a moment. You take a deep inspiration. The patient is in a supine position, beats etc. removed. The head is slightly turned upwards. And then you take a deep breath, close the nostrils with your left hand fingers. Take a deep inspiration and apply your mouth in such a way exactly the lips fit into the lips of the patient and blow air into the mouth. And then your exhaled air enters the lungs of the patient. You have exhaled air and it enters the lungs of the patient. Now you withdraw your mouth. You withdraw your mouth. And then when you withdraw your mouth, the patient exhales passively. The air comes out of the mouth. This completes one cycle. Repeat the cycle at a rate of 15 per minute. This must be continued until normal respirations are there. The important things to be remembered is to show that nothing is obstructing the trachea. Last time when we have given artificial respiration, people have not written very clearly, only briefly they have written. All the procedures also were not mentioned clearly. Only mouth-to-mouth breathing, that too around 2-3 lines they have written. All the steps have to be written. You may be thinking that we have written, you are not given much, but all the steps and all the procedures have to be, at least names of the procedures also you people have not written properly. But the important points to remember is see that nothing is obstructing the trachea. If there's any manual obstruction, means whatever you do, it will not work out. Then we have to see that nothing is obstructing the trachea. Suppose 3 to such attempts you have given and then there's no improvement in the patient, then you think that something is obstructing, and therefore what you do is give a hard blow on the back of the spinal region. On the spinal region on the back of the patient, they give a blow, hard blow to deliver the obstructing, then the obstructing material comes out. And this is also important to see that there's no obstructing, nothing is obstructing the trachea. The signs of your mouth-to-mouth breathing, I have told you. Inhale deeply and apply mouth to the patient's mouth, blow into it, and then partially afterwards you remove your mouth, exhale partially. This should go on until the normal respirations start. And you have to see after 3 to 5 things, if there's no improvement, you have to suspect something is obstructing, and you have to see whether there's anything. And you try giving a hard blow on the back and see if anything is obstructing, it will come down automatically, come out automatically. Then the improvement, how do you know the patient is improving? There will be improvement in pulse. You have to see whether the pulse you have to see, and you will find that the pulse, previously the pulse was not normal, and now it's improving. And previously the people may be dilated, and now it is returning to a state of construction, and the patient is returning to consciousness. He may become unconscious after the drowning. Therefore, pulse you have to see, pupils you have to see, and the level of consciousness you have to see whether there is improvement. And these signs will clearly show you that the patient is coming out of the danger or not. And morphine poisoning, you remember that suppose it is a case of morphine poisoning leads to construction of people. Whereas asphyxia dilates people, therefore in asphyxia only the people should, it returns to constriction. Therefore aspiration failure is not associated with pupillary dilatation in morphine poisoning. Suppose it's a case of morphine poisoning, the pupil may not be dilated. Only asphyxia due to other cause may be associated with pupillary dilatation, and we try to see, we put a torch in the pupils and see whether it is in a constricted state or not. In morphine poisoning, it's already in a constricted state. Advantages can be applied immediately, no instrumentalization is necessary. Last eyelid volume, about 1000 ml. It depends upon how much air you blow out into his mouth. Last tidal volume can be obtained. You can blow out, a strong person can blow a lot of normal tidal volume is 500, and now you can blow about 1000 ml. Now the carbon dioxide is present in the expired air. whatever expired air you're blowing it to the mouth, it contains carbon dioxide, and as we all know, the carbon dioxide is a respiratory stimulator. Carbon dioxide is a respiratory stimulator, converting into hydrogen ions and then stimulating the chemical respiratory center. The technique is simple and does not require instrument. All these things are advantages. The technique is simple and it can be applied. The air you are blowing is in carbon dioxide is there inside, and this is a respiratory stimulator, chemical regulation of respiration. I told you, carbon dioxide enters and it crosses the blood-brain barrier, and then it is converted into hydrogen ions by carbon ions. And again, the hydrogen ions are converted. This hydrogen ions is a direct stimulant. And here the head neck position. You see the head neck position. It is a little bit bent downwards. See here, neck position is like this. Here, this flow will be more straight. Air will enter more easily. Here, if it is in this position, doesn't enter so freely. But in this position, it enters. Therefore, we slightly bend the head downwards like this, backward, like extension. Like this. We are applying the lips. Should I apply tightly? If it doesn't apply tightly, the air will escape. And the air will escape. And he's just applying his air to see if it is exhaling or not. So if anything is coming out of it or not. This figures, see how slight extension of the head that makes the airways easily enters. The air will that we apply very easily and compared to this position. And disadvantage coming that the person who is giving mouth-to-mouth breathing may go into exhaustion. That is, we cannot do it for a very long time. We feel tired. That is one great disadvantage. And the infection, rate of infection in either direction, whether it may be from us or from them to us. Especially in these corona times, it is not advisable at all. Another method. We have finished mouth-to-mouth breathing, Magellan's method, and now we are going into Schafer's method. All these procedures are important. You have to mention whenever theory question comes about these methods. Practically also, viva questions also, it is very important. In Schafer's method, subject is again placed in a prone position. That is a head-down position, prone position with a small pillow. A small pillow is placed under the epigastrium and upper abdomen. A small pillow is placed. Small pillow underneath the epigastrium and upper abdomen. And then head is turned to one side. Now the operator, what he does, he kneels by the side of the subject, and the patient is in a prone position, head down position. The operator sits by that side and raises his two hands and the lower part of the chest, scapular region, and the two lower parts of the chest means that is scapular region. Yeah. The patient is in a prone position, head down position, face is turned to one side. The patient kneels by there is a step that the helpers kneels by the side and is applying pressure on the lower scapula, the inferior scapula. And then he puts whole his body forwards and presses on the lines. The intra-abdominal pressure rises. The pressure on the lines and rises the intra-abdominal pressure. And this pushes the diaphragm upwards, and air is pushed from the lung. Then the pressure is released. That is the expression. The act of expression is done. The diaphragm is pushed upwards, the intra-abdominal pressure increase, air is pushed out, expression occurs. And to come to the, again after he removes it, then the lungs come back to the original position, abdominal pressure falls and diaphragm descends and air is drawn in this manner. And this is a absent inspiration, and this is drawn in this manner is repeated 12 times. 12 times per minute. That means same thing, applying abdominal pressure in a prone position. Just like that, applying abdomen pressure which is sort of air is there, and it helps in expiration. And removing the hands here, it causes inspiration automatically. It is in all the nurse method, what happened, we were lifting the arms upwards. They were assisting inspiration also. Here, inspiration is not assisted, but just we are keeping quiet. We are just removing hands after expiration, and then automatically it is attacked. Respiration is 12 times per minute. Yeah, advantage is subject is in a prone position, they have the same advantage. Mucus, saliva, vomitus, everything comes out and do not obstruct the respiratory passages. This everything is coming out, and therefore same advantage. When the patient is in a prone position, the same advantage is there. Disadvantage is their expiration is done first. There is pushed out of the lungs to cause expiration. Here the expiration is active, whereas inspiration is passively active. Normally, inspiration is active in our daily routine. Inspiration is active and expiration is passive. But here, expiration is active. We are pushing air out of the abdomen, therefore just and therefore expiration is active, inspiration is passively occurring. Here, Shabbos method is pushing, expiration occurs. Here, respiration of the subject is occurring in expiratory reserve volume. That is, expiratory reserve volume is much less when compared to expiratory reserve volume. And in prone position, expiratory reserve volume is still less. Therefore, this is the main advantage, disadvantage. It is even less if the subject has a long-standing obstructive disease of the lungs. The tidal volume may be much less in this procedure with all these conditions, and along with this, this thing, if is having a long-standing disease of obstructive disease, then it may be tidal volume may not be much. Then we go in for Sylvester's method. The subject is placed in a supine position. Again, here like mouth-to-mouth breathing, it is placed in a supine. Schafer's method and Jensen's method, we placed in a prone position. Mouth-to-mouth breathing in Sylvester's method. We have placed the patient in a supine, that is head-up position. Operation, the operator, the person who is doing the procedure needs at the head of the subject. What happens? The arms of the subject are raised above its head. Both arms are raised above the head, like this. The hands are raised and above the head, and then folded over the chest like this. Hands are raised like this and folded over the chest. And he compresses the chest wall at the same time. He presses on the chest and he compresses the chest at the same time. Here, raised and he compresses the chest at the same time. Here, Sylvester method. Hands are raised first and then folded near the elbow joint here and compresses the chest. He is removing the weights from his mouth. The hands are playing like this. And then again, first come on the chest. This is position 1. This is position 1. Here, position 1, the hands are lifted like this, upwards. Sylvester method. This is position 2. After lifting, the hands are folded and is pressing it on the chest. Here, the first part is just removing the beads. Here, first removes the beads, hands are folded like this. Here's a drawing. In such moments, what happens is they alternately increase and decrease the size of the thoracic case, and this procedure is repeated at a rate of 12 per minute. Disadvantage. The disadvantage is the patient is in a supine position, and therefore lung is likely to fall back and obstruct the passages. And therefore we have to, all the way we have to see that the tongue doesn't fall back. We have to keep an eye on it. Otherwise there's no use. Therefore you have to see the tongue is not obstructing the airways. And again another disadvantage said the mucosal, etc. is likely to enter the respiratory passages. In a prone position, this danger is not there. In a supine position, we may remove some of it, but a little bit of it may be remaining, and this may be enter into the respiratory and further obstruct the airway passages. And therefore, in this method, both expression and inspiration are active. Therefore, tidal volume is more than that attained in Shepherd's method. In the raising the arm, and when we are raising the arm, inspiration is occurring, and when we are pressing on the chest wall, expression is occurring. Now we have seen that manual methods. Now we are going for mechanical methods. Manual methods finished. Mechanical methods. Mechanical methods advantages, we don't feel strain. It can be since they are working on some instruments, they can be continued indefinitely. They can be used in conditions like morphine poisoning, respiratory muscle paralysis, and they are more efficient also. Because artificially depends upon the manual methods and depend upon the person who is doing the skill of the person who is doing it. Suppose we have the person who is not very skilled, the method may not work out properly, and therefore it depends on the skill of the person. Therefore, these methods are better than the mechanical methods are better than the manual method. And we have two types: negative pressure method and positive pressure methods. Negative pressure methods are by alternately compressing and relaxing of the chest. These are negative. First, I'm going to discuss negative pressure methods. Alternate by compressing and relaxing of chest wall. Drinker's method. Drinker's method is here the patient is placed in an airtight chamber. The chamber is there, patient is placed in an airtight chamber, and his head is outside. Pressure inside the chamber is alternately increased and decreased, and through a tube. The chamber is connected with the tube, and the pressure is inside is increased and decreased alternately. It's an airtight chamber, and the pressure is controlled from outside through a tube. Only the patient's body is the head is outside. And when the pressure inside is increased, expression takes place because it causes compression of the chest. And when the pressure is reduced, atmospheric pressure, expression takes place. As simple as that. Body placed in the tank, head is outside, and the pressure inside is controlled by a tube connected to it. Increased pressure causes expansion, decreased pressure causes inspiration. Disadvantages can be used in chronic patient, and disadvantages: the peripheral veins are exposed to negative pressure. The peripheral veins are exposed to negative pressure. When the peripheral veins are exposed to negative pressure, what happens? We are giving positive and negative pressures. The venous return to the heart decreases, and this in turn may decrease cardiac output. This is one of the disadvantages. Another one is that it helps in only in hospital setup. It is not available in a field setup. Field setup or anywhere near drowning places of drowning like beaches and all, it is not. Brag box method. The rubber brag is wrapped around the chest. The bag is wrapped around the chest, just like a BP bag, BP cup being wrapped around the arm. Rubber bag is wrapped around the chest. And air is pumped in and out of rubber bag. BP cup, we are wrapping around the upper part of the thorax. The same way, rubber bag is wrapped around chest. Air is pumped in and out of the rubber bag. When the bag is inflated, suppose that we are sending it now, when we are pumping air into it, chest is compressed and air is expelled up. And the pressure is released, water just partially enlarges, then inspiration. Expression. Just imagine a BP. Now negative pressure methods finished. Now we are going for positive pressure methods. Positive pressure method, continuous inflation. This is used in mostly in operation theaters. Continuously we are doing this operation theater. We have got the continuous inflation method, intermittent inflation method, and resuscitation method. Three methods: continuous inflation method, intermittent inflation method, resuscitator method. Resuscitator method is air is supplied intermittently by application of positive and negative pressures to the mask fitted to the face. A mask is fitted to the patient's face, and positive and negative pressures are given intermittently. This is called resuscitator method. Positive pressure is given during expiration, negative pressure during inspiration. And the advantages of this method is can be given for prolonged periods. The ventilation of the lung is good. Ventilation of the lung is good, can be given for a prolonged period. Air is fortified with oxygen can also be given. These are the three advantages. Disadvantages: increased positive pressure may cause damage to lung tissues. Increased positive pressure may cause damage to lung tissues. And the continuous monitoring, a person should monitor continuously. Continuous monitoring is necessary. You cannot leave it, apply it and leave it and go out. Continuous monitoring is necessary. Tank respiratory method. Patient's body is placed inside a tank with head outside. Head should be outside. At the foot of the patient, there's a leather diaphragm is there. And which moves, when it moves inwards, it creates positive pressure of 0 to 5 centimeters above that. When it moves outwards, it creates negative pressure out, managed to facilitate expiration and inspiration. That is a patient foot, that's a place inside a tank. Same thing, the head outside, the other diaphragm at the foot end. The inward movement of it causes a positive pressure of 0 to 5, outward minus 10 to minus 20. Outward pressure causes inspiration, minus temperatures causes minus pressures cause inspiration, plus pressures cause expiration. Here's the tank respirator, body kept inside. Here's the monitoring, the leather diaphragm is there. Inside the negative pressures and positive pressure. Positive mechanism for applying positive and negative pressures. Tank respirator, this is called. These are all controlling knobs. Therefore, a person should be there to monitor all these things. Electrochronic respirator is it's an electric device for stimulating the phrenic nerve. Boyle's apparatus. Boyle's apparatus. In hospitals, it is used for giving artificial respiration, artificial ventilation. Operation theaters, you might be seeing all these things. You'll be seeing in your clinical postings. It is an automatic instrument. In this rate, depth of ventilation, composition of air, everything can be controlled. Rate and depth of ventilation, composition of air, etc. can be controlled. Artificial ventilation. This is Boyle's apparatus, very important. We'll see in all theaters. Here's the Boyle's apparatus, rate and depth, the amount of air, the amount of nitrogen, the amount of gases you are doing. All these things can be controlled. We'll see in an operation theater. Here, Boyle's apparatus. Is that patient monitor? Yeah, monitoring instruments is also there. Heart rate, BP, ECG, everything monitoring is there. You monitor and accordingly we can adjust. These are all monitors. This is the anesthetist manages all these things. Newborns, so holding upside down. Immediately after the baby is born, it will not take up breathing. Therefore, the pediatrician or the gynecologist holds the baby upside down and pats on the back. Holds the baby upside down and pats on the back. And alternately putting cold and hot water on the splashing cold and hot water on the baby's body. That is another way for initiating respiration. holding upside down and patting on the back, that is slapping the back of the buttocks, putting splashing with cold and hot water. Then another procedure is suppose the baby is not taking breath immediately. A mixture of carbon dioxide nostril mixture is through nostrils, another through nostril through tube, mouth to mouth breathing, slapping, cutaneous stimulation. All these things are, if the baby is not taking breath immediately after the baby comes out of the mother's womb, it should take a breath. If there's any delay, the pediatrician and the obstetrician try to going for all these procedures. Here, holding the baby like this, slapping the upside down, holding the baby. Methods of artificial respiration. This Heimlich's maneuver. Suppose a patient has swallowed some foreign material, some foreign is choking, some bone or anything, for a piece, bone, anything, choking on foreign material. Sudden increase in what happens? Sudden increase in intra-abdominal pressure is produced. It's a quick thrust on the patient's abdomen. A quick thrust is given on the a quick thrust is a sudden increase in intra-abdominal pressure. This big punch-like thing, thrust on the patient's abdomen above the umbilicus and below the tip of the sternum is given. Suppose some person has swallowed something accidentally, and it has got inside his respiratory passages. Here, adult, he has swallowed something. Yeah, in this region, a sudden pressure has to be given. It's like you have to hit with your here you have to give a punch like this thing. Here is a baby punch. This region you have to. That's all. Suppose you have swallowed something, it has obstructed his airways. This increased abdominal pressure when it's giving a sudden punch like force, the diaphragm upwards, it forces the diaphragm upwards. And this causes increase in alveolar pressure upwards into the lungs. Powerful expression is produced, and thereby whatever the object is caught in the respiratory tract, it automatically happens. But the punch should be very powerful, more hard punch should be applied. Then only increase in alveolar pressure will occur, and powerful expression will be produced, and whatever has been followed will go down. Okay, thank you. And with this, I close the class.